Hey, I'm Dr. Joe Niamtu, LoveThatFace.com, cosmetic facial surgeon in Richmond, Virginia. I do cosmetic facial surgery from here to here. I don't do boobs, bellies, or butts. I'm a teacher, an author, a surgeon, and a double-boarded cosmetic facial surgeon. So today we're talking about one of my favorite procedures, and we have a great patient, so gracious to join in on this. And we're talking about eyelid surgery. In her case, we're going to talk about upper eyelid surgery. And so when we look at her, and you don't have to zoom in now, Hannah, but when we look at her, her brows are fine. She's got beautiful brows. They're high. They're not drooping at all. And her lower lids look good too. So it's pretty much upper lids. So we can zoom in here a little bit and tell us what is it that made you want to come see me about upper eyelid surgery?
Well, when I can't really wear eyeshadow anymore, and I'm noticing that when I take all my makeup off, it seems like my eyelids are just drooping in front of my upper lid. And so when I do wear makeup, I feel like my eyelashes are holding the eyelids back.
And that's a great observation because they are. And when we zoom in a minute, in the next frame, you'll see that. But that's what really kind of makes people, once they notice that the skin is resting on their lashes,
Yes.
That really kind of makes people, especially women that have these makeup mirrors that are very magnified, okay? And so the upper face ages faster than the lower face. And, you know, our patient here, she has great cheeks, good nose, nice chin. She does not need a facelift or a brow lift. So, you know, it's just her eyelids. And what we would propose to do here is to do her upper lids and sculpt those upper lids, remove that extra skin. And on her lower lid, she really doesn't have any fat, so we would do laser resurfacing. So we'll get a close-up and come back in. All right, so one of the things that I tell patients, close your eyes for me a second. If I pinch this skin, open your eye, grab it and pinch it and let go, if you can see that excess right here, open, that's kind of when you know you need your eyelids done. And this is the skin that we're going to remove, this extra skin. And sometimes we'll sculpt the muscle. And if there's any fat in there, which she really doesn't have much fat, her problem is really just skin. Now, if her brow was real low, you know, you would talk about possibly a brow lift, but her brow's perfect. It's above that bone. So again, it's this stuff right here. And if I lift this up and look in the mirror 1 second there, okay? So that's kind of what your lid's going to look like, okay? Now you can drop the mirror a second. So that's what our goal is, to have more of a sculpted eyelid. And on the lower, we're going to laser these wrinkles and make that look more like that. So I think you'll be an excellent patient. So our plan is to do upper eyelids and lower lid laser resurfacing. I use laser for my upper eyelid incisions, and it's a bloodless surgery. There's literally no blood loss, and that means less pain, faster healing, less bruising, okay? Okay. And I've done over 6,500 eyelids. It's absolutely one of my favorite surgeries, and this is a great patient. She's so nice. She has very realistic expectations, and I'm excited to do the surgery. If you have any questions about eyelid surgery, facelift, or any cosmetic facial surgery procedures from here to here, give us a call. We're at LoveThatFace.com. I'm Dr. Joe Niamtu. Thanks for your time, and thanks for your time.
Thank you.